she is part of our leadership team, along with, are we here? Julia. And Julia's the secretary of the leadership team, and treasurer Mary Jo is back there in the black. That's all I'm going to say is just welcome. Get a hold of one of us if you're interested in learning more about our activities. Dani. I'm going to let Dani introduce herself and the members of the panel. Take it away.
Okay, so hi everybody. I am Dani Cook. I'm really grateful that you all are joining, that some of you guys are watching via Zoom, on YouTube, and all the things, because this is a really important thing that is very near and dear to my heart. I don't even know what title to give myself. I'm just an advocate. I'm just somebody who got concerned about healthcare because it impacted my hometown and the region where I'm from. It was a very organic thing that happened. And just to kind of give you a nutshell, we got a COPA. At the time, I had no clue what a COPA was. But a year prior to that, my granddaughter had been born weighing a pound and some ounces. And she was taken extremely good care of at Holston Valley Medical Center's NICU. Fast forward a year, and some of the nurses reached out to me. They said, "We don't know what's happened, but we're hearing they're going to close our NICU. And we don't know anybody else that could help." And I have a decent social media following. And so I really thought, surely to goodness, the powers that be can't know all of these things and just how bad this will be. Surely, if we just make some noise, this won't happen. And I was wrong. So we ended up leading a protest that has lasted for a really long time, but we camped outside of a hospital for 257 days, 24 hours a day, 7 days a week. So now I continue to do all types of advocacy work and podcasts and all the things. But along that journey, I met the wonderful people that you see here on the panel. So I have got, gosh, I don't even know where to start. I will start with my first connection that I made, which is Dr. Susan Johnson. She's a pediatrician, and somebody that I trust implicitly from a medical perspective. I have great respect for. It's funny because we didn't agree politically on a lot of things, but we always had really great conversations that were respectful, that created understanding and things like that. And so it's great that on healthcare, we agree it shouldn't be partisan. And so we get to advocate together for the health and well-being of people. Next, I got to know Wendy Vogel. And Wendy Vogel is in the oncology field. And we had some changes within our cancer treatment center and our infusion center. And I got to know Wendy and a couple of other folks as I heard and learned about the changes that happened with what was available to people, the cost of treatments, different medications, and how those things changed. And so Wendy is here to speak to that. And then Dan Polgears is a medical consultant. You guys should have this in a little printout. He was against the COPA from the start, right? He was very outspoken about just the harms that come when you get rid of competition and what can happen. And so he spoke a lot during the public hearings, which was way before I even knew what a COPA was or what was going to happen. He was kind of boots on the ground as our health department held public hearings about this issue. And so when Helen had asked me if I would put this together, I said, sure. And I said, Dan, what they're talking about getting a COPA in Indiana. Do you want to come help share and inform people? And he said, absolutely. And I said, awesome. I appreciate that. And then there is Dr. Alex Mackey, who is a general surgeon over in Kentucky now. Her daddy worked, I said, daddy, like I know your dad. I feel like I do know your dad through you. But he worked at Holston Valley Medical Center in infectious disease for a number of years. She did her rounds there. She rounded with different people when she was going through med school, and her dad had an experience there as well. She has both a personal, as I think all of us do, a personal and a professional view as to what's happened, not only with our healthcare and our hospitals, but with our communities as well. And so she's joined me on my podcast a couple of times, and I'm very grateful to her as well. So we all have things to share with you guys and kind of go from there. So I want to start with just saying this. I want to start by just explaining what a COPA is. People say, what's a COPA? It's a certificate of public advantage. What does that mean? It means that it's a law that your state has created saying that if there are hospitals that may be in financial trouble, and your state's COPA is a little different than mine. So let me share with you what your state's law actually says. So your current law says only hospitals that meet the following requirements may submit an application. Originally, you could submit an application for a COPA up until July 1st of 2026. Your new law says that they have to submit a COPA application by May 13th. Now, Union and Terre Haute have already submitted their application, but these were the requirements. It had to have the hospitals had to be located in a county that had less than 140,000 people and is not contiguous to a county with a population of more than 250,000. It also had to have only 2 hospitals that are both in the statewide comprehensive trauma care system. And one of those 2 had to be a teaching hospital with a medical residency program. And then it had to be a predominantly rural county, right? And so that's Vigo County, and that includes Union and Terre Haute. So that the purpose of this was to be able to help hospitals be able to provide care and kind of work together. But COPAs don't work well for really anybody except the people making money. They don't do good for patients. They don't do good for employees. They don't do good for the community. They definitely don't do good for independent providers. So there's a lot of negative impact that comes with it. So your new law says that any hospital that intends to file for a COPA has to submit an application by May 13th of this year. Okay, so you've got one in, and this is probably the only one you're going to have. I love that because that means you're not going to have any COPAs after this. And if you all as a community work your tails off, maybe you won't get this one. Maybe your health department won't grant it, and that will be amazing. So let me tell you how long you have, and then I'm going to turn it over to everyone to just introduce themselves briefly. Okay, so you have until November 9th in order to, November 9th of 2025. So here's what happens. This application has been made to the Indiana Department of Health. They have to have a decision by November 9th of 2025. Okay. It also says that the new provision says that the Attorney General's office has to consult with the Indiana Department of Health during the application review process, which ours did too. It didn't make much difference in my opinion. And so this is the verbiage that you want to know, and then we're going to talk about what this means later. The legislation maintains that the existing requirement that the COPA applications must demonstrate clear benefits to population health outcomes, healthcare access, and quality of care, and that the potential benefits of a merger outweigh any reduction in competition. I'm very familiar with that clause. It didn't make a difference to me, to our community, but that's what a COPA is, just so that you understand. In our case, it gave state action immunity, both on a state level and federal antitrust immunity is what it did. Our law said that they were going to intentionally displace competition, which that's horrible, right? We don't want to do that. And in favor of a medical monopoly. That's what it said. And it violated our constitution for the state because our state constitution says can't have a monopoly, but we do. All right. So I think that that's a good overview of what a COPA is. Hopefully you guys were going to have a Q&A at the end of this. But next I would like to start with Dan, if that's cool, and allow Dan to share with you who he is and kind of why he wanted to be here and what he wants to share with you.
Well, thank you very much, and I appreciate the opportunity. I guess first off, it's really important for me to say because I'm an independent medical practice consultant. I work with multiple practices in the area, not only in Upper East Tennessee but throughout the state. I also have practices that I work with throughout the country. I'm here today solely for myself. I'm not representing any of the groups that I work with, whether they be in Upper East Tennessee or other parts of the state. Like Ms. Cook had said earlier, early on, I knew this was a bad idea. I'm a conservative. It's interesting. Dani and I do not talk on a regular basis. It's probably been a couple years since I've heard from her. But at one point in time, I was on the local advisory committee for the COPA. I was appointed by then Department of Health Commissioner John Dreisner. And shortly, I used to talk to her on a regular basis then because she was constantly contacting all of the members. And I did my best to take information from everyone in the community that reached out to me because I felt like I was probably the person on the advisory committee that was least in favor of this type of a merger. I think it's also really important. Dani and I had this conversation shortly after I left the local advisory council that she and I probably do not share any other geopolitical or state politic view. But we did have one thing in common. She had a granddaughter in a NICU in one of our local hospitals. I had a son in the NICU of one of our local hospitals. So I took healthcare, and I was originally a healthcare provider, and I moved to the area. I was actually recruited by Johnson City Medical Center as a occupational therapist and hand therapist about 28 years ago. But I quickly fell in love with this area, and I believe it was because of my conservative beliefs that I knew that monopolies were only good for the monopoly. That when you have a situation, whether it's in healthcare or not, I knew the quality was going to go down, costs were going to go up, and employment issues were going to arise. And I also had the opportunity to sit on a panel with the FTC. I believe that was back in the early 2000s, maybe it's 2019. You can actually watch that videos from those, and it's interesting because when you go back and you look at some of the information that we talked about, a lot of those things actually did happen and have continued to happen at our local level. So that's just a little bit about me, and I have other information to share, but I'll wait until after the introductions are met.
Awesome. I appreciate you, Dan. Yeah, he's right. He did hear from me quite a bit, as did everyone on the local COPA advisory board, on any board, any state, city, county institution. Yep, everybody heard from me. But let me just tell you, folks, listen, the squeaky wheel gets the grease. If nothing else, we got attention. And here's the thing. We have to advocate for ourselves and our communities. Unfortunately, corporations are getting away with a lot, and people matter. And so we have to make sure that the people that are running things know that people matter, and we are going to require that of them. So I appreciate you for being here, Dan, and I'll circle back around to you in just a second. Next, I'm going to shoot on over here too, because you're next in my window, is Dr. Alex Mackey. I'll let you introduce yourself and let the folks know what you got.
Hi, Dani and I met through a reporter, actually, and another, we'll call it victim of Ballad. I really did not believe how bad it had gotten until I witnessed it firsthand. My father had an acute MI. He went to Holston Valley Medical Center. We had previously been treated for an MI, and they denied it even happening. And so I had to have him air flighted out of there because they weren't going to do anything, and he was slowly dying. If you had told me that 7 years ago, I would never believe that could have happened in America. And I'm very concerned that Indiana's right across the river. I'm in Louisville, Kentucky. I'm a general surgeon here. It is right across the river. And I really am pretty concerned that this COPA. I mean, why do you need a COPA? I mean, like, why do you need to be immunized against like any safety protection? You should be able, if you can prove that there's benefit, you shouldn't need that extra step. And that's why I'm here.
Yeah, so I will say this, out of everybody that is here with me, it will probably be Alex, Mackie, and myself that will probably have the most forthright words when we talk about ballot, as you just heard her say, victim of ballot health. Yeah, and I think that's also because we both, it's just personal, right? I mean, this is her dad, so it's very personal to her, and I get that in every way, shape, or form. So
it's the community too. I grew up there, and so it's my friend's family too. You know, like, it's not just like, I mean, there are multiple victims. Like, look at Google reviews. Just look at the Google reviews.
Yeah, definitely true. So I appreciate you, Alex, for being here. Dr. Johnson, you are next. So
yay. So I'm Susan Johnson. I'm a pediatrician in the area, and actually worked in independent practices in the area, but actually was employed with Mountain States for a long time. I worked in their pediatric emergency room for about 7 years. And then when the merger was occurring, I was in outpatient employed practice in Kingsport, Tennessee. And our community was affected as far as pediatrics is concerned in the closure of the NICU quite intimately. I also, my family, I've had my mother and father in the hospital off and on. My dad's deceased now, but I have experienced the decline with my mother. I think I do have some unique perspective in that I am now independent. I left my practice, was trying to negotiate because we had sort of been promised that we would have, when the merger happens, you're going to have, oh, sorry, my timer went out on my light. You're going to have an NICU. That's the great thing about the merger. You're going to have an NICU. And we were kind of promised that for years. Then to be brought into a meeting with the OBGYNs and pediatricians in our community and told we're closing it and this is the best thing. And, we were all in a bit of shock. So we went through some challenges, even though we all loved each other as 6 pediatricians who enjoyed practicing, about how to make a response to the hospital system to get what we felt like was right for us and right for our patients. I ended up leaving because I felt like in the interaction, it started to feel sort of unprofessional and uncomfortable. And the practice ended up leaving Mountain States, or at least 4 of the people left Mountain States and went to another local practice. One did transition with Ballad, and then I just went out on my own because I felt like it was the best thing for me to do. I do have a relationship with Ballad and love the people that I interact with and work with in pediatrics. And I will say that overall, I don't think it was great for our community. There are some positives that have happened for us in pediatric, but they have been well fought behind the scenes and had to do with like funding changes. I'm more than happy to talk about that. Like Dan, for a long time, I have considered myself a moderate conservative. That feeling's kind of changing recently. Over a lot of personal feelings about just things in general. But I have long felt that competition is definitely the way to go. And I'm happy to share. I have specific concerns that I'm more than happy to share about, like workforce and non-compete and how that affects you. And my husband left the area. He works away now. That was a very, difficult decision, but it was the right decision for us financially. There were lots of things. I have a daughter that's a physician who has said she will not return to the area because of the business atmosphere. But there have been some good things. So I don't mind talking about both, just to be clear and honest. And it's been great knowing Dani. She is a warrior. No other way to describe her.
I appreciate it. So are you, though. That's the thing. We just do it different.
Yeah.
You do it much more nice. She
Most
does
of the
it
time.
yeah, she does it just with a little more tact. And I do start that. Let me just say, I start that way. And I would we did start this way. I want to go back and give the folks in Indiana just a little bit of clarification. And before I let Wendy tell you about her, what Susan, what Dr. Johnson is referring to is we had two healthcare systems in our region. So geographically, we are Northeast Tennessee and Southwest Virginia. So we are geographically the size of New Jersey. All total together, it's like 1.2 million people. And our two healthcare systems were Mountain States Health Alliance, which you heard Dr. Johnson talk about, and then Wellmont Health Systems, right? I was always a Wellmont girl. And so when our COPA law was introduced, it was introduced by a state legislator who was a paid contractor for the healthcare system, right? Although, they swore up and down that wasn't a conflict of interest because he told everybody where he got money from. I still think it's a conflict of interest. When those two healthcare systems merged, major things happened in our region. I'm going to tell you some of those specifics. And I want you to know that I pulled up some of your numbers as well. And I have our numbers prior to the merger. And the reason why I'm doing that is because I want you to know the type of healthcare you have today, the type of healthcare we had prior to a COPA being granted, and the type of healthcare that we have today that you could potentially be getting if your health department grants a certificate of public advantage to these two healthcare systems. There has never been a COPA that has been good for the people, the patients, the employees, and the communities, not one. I've actually got the latest FTC comments specifically about your COPA. I'm going to read some of that to you as well. And then what I'm going to do, if you guys would like, is I want to put all of that in a Google Drive for you so that you can look at the application yourself. I'm going to warn you, it's 247 pages long. They do that on purpose. I'm going to give you all the FTC comments so that you can have them, the supplemental statements that go with them. I will make myself available to do this as much as you all need between now and November 9th so that you can really save your hospitals by not granting a COPA, okay? So yeah. So when she talks about warriors, it wasn't just me. I need to say this about my community back home. My community back home is heavily Republican. There's no other way to say it. They are very conservative, very Republican, very white, very all the things, right? Much of the things that I am not. But I was born and raised there. That's my hometown. That's my community. Lived there my whole life. And when so when we fought really, really hard to keep our NICU open, the one that saved Bella's life, my grandbaby's life. And when our new commissioner of health finally said, yes, they can close it, I did not know what else to do because we had done community hearings, we had done forums, we had been at the local COPA hearing, we'd done all the things. They can tell you that. And I didn't know what to do. And so I reached out to a friend of mine who tried to convince me not to do it. And I said, okay, I'm getting a nudge. I don't know what else to do. And so the very next morning, May the 2nd, I had a backpack, a laptop, a sleeping bag, and a couple of signs that I made with some stats. At 8 o'clock in the morning, May 2nd of 2019, I went and sat in front of Holston Valley Medical Center where my grandbaby was rescued and treated so well. And I went live on Facebook and I said, I'm not leaving until somebody does something. I had no idea that meant 257 days, 24 hours a day out there. But here's what I will tell you is that community came out with me by noon. There was about 50 folks outside with me. And for 257 days, there was at least 10 of us that were there every day. And sometimes way more than that. So I'm not the only person that's a warrior. That community came together. We got 28,000 local signatures, and 15 of us took them to DC, to the FTC. So, like I said at the very beginning, this is not a partisan thing. This was something that everybody could get behind. And I am super proud and super grateful for the people that participated in that, in whatever way you could. Some of you very much behind the scenes, some of you right outside under some canopies with me. So with propane tanks by the time it got to be winter. So I just want to say that I'm not the only person who was warrioring over this. It was a lot of people in the community. So appreciate you, Susan. All right. So next up is Wendy Vogel. I'll let Wendy share who she is and why she came to be here.
Thank you, Dani. I am really happy to be part of this Warrior Woman panel. Sorry to our male with us, but I am very, very passionate about oncology care, and that's why I'm here. If you look around the room you're in, 1 in 4 of us is going to be diagnosed with a cancer during our lifetime, and that's going to increase. By 2030, cancer cases are going to increase by 45%. The COPA allowed the valid healthcare system to fail cancer patients at their sickest and most vulnerable time. I am an oncology nurse practitioner. I've practiced in this region. I grew up in this region. And the difference I saw when I was working for the Legacy Holston Valley is I was proud to work there. I was proud of the most amazing cancer system we had, and I watched it day to day be destroyed. I got to see how the sausage was made. I was on the board of directors for the Wellmont Medical Associates. Interestingly, when presented with the information by the COPA advocates to this board, and they knew going into this, they told this board, we don't expect that we can do all the clear benefits that Dani was talking about earlier. They knew going into it. It was already anticipated, and still it was. I was a member and then chaired the Advanced Practitioner Committee for Wellmont Medical Associates. I was on the Oncology Continuous Improvement Committee and on the Oncology P&T Committee, which is the Pharmacy and Therapeutics Subcommittee. And what I saw was astounding. My advice, and I'm happy to talk about all the things that I saw, but my advice is don't do it. The promises of oversight and public benefit under this COPA were not upheld. And the consequences, especially in specialty care like oncology and pediatrics and the things we're going to talk about today, are harmful, far-reaching, and very difficult now to reverse.
100%. Yeah, so all of us have very, very strong feelings because this is our community. And I can tell you that all of you will have very strong feelings if your Department of Health grants these 2 hospitals a certificate of public advantage, because it will allow them to do things that would not normally be able to occur because of antitrust laws, right? So what I want to do very quickly is I want to share with you just a few of the things that the FTC has said about the COPA application from Union and Terre Haute. Okay. And I might be butchering that name. Forgive me. I'm a country girl. So, it's just one of those things. All right. So this is their second application. But one of the things that the FTC starts off with is they said, listen, very little changed from the first application to the second application. They are basically the same thing, saying the same things, just in different words. So here's what they said. Our comment analyzed the proposed merger and concluded that it presented a substantial risk of serious harm to competition and consumers through higher healthcare costs, lower quality, reduced innovation, reduced access to care, and depressed wages for hospital employees. We have seen all of those things come to pass in our region, every single one of them. And just so you all know, the FTC came and appeared at our public hearings 3 different times, and our state ignored them. Don't let your state ignore the FTC. They know what they're talking about. It showed that the proposed merger's effects would likely be felt most acutely by patients and hospital workers in Vigo County, where the merged entity would have a combined share of 74% of all commercially insured inpatient hospital services provided to county residents. So that we are talking about a monopoly, folks, 74%. So I want to tell you, they had withdrawn this literally days before your Department of Health was going to make a decision. That's when they withdrew it. And then they resubmitted it. So this is what it says. Specifically, their comment discussed the parties' newly emphasized arguments defending the proposed merger, including recent suggestions that THRH, that's the Terra, am I saying it right, y'all? Terra, y'all know what I'm talking about. TH. Somebody's saying it for me. Might close if the second application is denied. So just in the room, I can see you all from the back. Can you, with the raising your hands, have you all been told that your hospital is going to close if they don't accomplish this merger? I see somebody clapping back there. Anybody else? So let me just say this. This is what we were told. They were so adamant in our region, they bought a URL and made a website called Save Your Hospitals. Okay. So I just want y'all to know this is what they told us, but the FTC specifically addresses that and tells you that it is unlikely to close without this anti-competitive merger. So I'm going to put this entire document in a drive for you so that you can see for yourself why the FTC is saying that scare tactic is not rooted and based in fact. Okay. Just so that you know that. I want to also give you just a little bit of information. I tend to focus on the stats that I will be transparent and tell you. I want to get your attention. So I'm not gonna be like, oh, the C. diff rates were bad, because just wash your hands. You can get C. diff down, right? What I want to talk about are your mortality rates. So in healthcare, mind you, I didn't know jack about healthcare until this COPA thing happened on my radar. But a mortality rate means that people who are admitted into the hospital for this particular condition die within 30 days after being discharged, regardless of how they die. They get reported in that mortality rate. I want to share with you what Union's numbers, what Union Hospital is now. So for your heart attack mortality rate, it's 12.3%. That's no different than the national average, okay? TH, your other hospital, it's 11.3%. So that's your mortality rate for heart attacks. For our two hospitals, Johnson City Medical Center and Bristol Regional, which are our main two tertiary hospitals where the majority of patients go for these things, it is 15.6% and 15.3%. For heart failure, your two hospitals are 12.5% and 11.6%. Go ahead, TH, right? Heart failure for our two hospitals is 16.2% and 16.5%. Pneumonia, your two hospitals are 17.8%, 17.7%. So do you see how they're so similar? Our two hospitals, our mortality rate for pneumonia patients, 21.9% at Johnson City Medical Center. That's one of every 5 patients admitted for pneumonia at Johnson City Medical Center dies within 30 days of being discharged. The pneumonia mortality rate for Bristol Regional Medical Center is 23.6%. That is almost 1 in 4 patients. Stroke for your two hospitals is 14.8% at Union, 13.9% at TH. Stroke at our two hospitals are 18.5%, which is Johnson City, and 13.9% at Bristol Regional. Our numbers were not always like this. Currently, your hospitals are rated 3-star hospitals, both of them, by the Centers for Medicare and Medicaid. You can see that for yourself under Hospital Compare. I will also put that in a document for you, okay? Our hospitals were too. Johnson City Medical Center, prior to this merger, prior to our COPA, was a 3-star hospital. So was Holston Valley Medical Center. And Bristol Regional Medical Center was a 4-star hospital. They are currently 1-star hospitals today, with the exception of Holston Valley. Now, let me just tell you, one of the ways that you can finagle things is when you move some of your most serious services out of a hospital and then they're not scored on certain things, you can get that star rating to improve if you want to. But I'm going to show you, if it will let me, what that looks like really quickly. So this is, is it going to let me? Maybe not. Sorry, guys. Give me 1 second. It might not. It said no. Ah, look at there. This is one of your hospitals. Can you all see that on the screen? So you can see that Terre Haute is 3 stars, right? Same thing for Union. Oh my word, where did y'all go? I said, okay. It took you guys completely away. I can't see you now. Why can't I see you now? That's not good, is it? Let me just stop sharing, see if that brings you back. It did. Holy geez. I will put zoom in, please. I don't know if it'll let me do that, but here's what I will do. I will put all of your stuff in a Google Drive so that you can see your scores for yourself. I've looked them up already so that you all will know what they are. Okay. So Dan, go ahead.
Well, I think it might be easier, and I looked at that same data, Danny, in preparation for this too, because I was curious as to what the hospitals did, and I do have a fairly good understanding of the star ratings. So I'll just say that when you look at complications and death rates in the CMS star ratings, Johnson City Medical Center, which is our level 1 trauma hospital, flagship hospital, in 5 of the 7 death rate categories, they're ranked worse than the national average, 5 out of 7. Yep. So that might be a little bit easier number to kind of digest. When I looked at Union Hospital, which is 3 stars, Union Clinton, which is 4 stars, and Terre Haute, which is 3 stars, you all fell 7 out of 7 in average, meeting the average, are no different than the national average. So that's particularly important when you're looking at the overall how they rate the star numbers. And sometimes we get caught up with the fact of a 3 versus 4 versus 5. What does all that mean? And I'll just tell you that back in 2023, one of our local news agencies ran a story on the star ratings. This was November 6, 2023. And they had a person who they believed was a national expert on it. And she actually concluded that a 3-star hospital was an adequate hospital, that you should feel fairly comfortable being treated in a 3-star hospital. But she said that 1-star hospital is pretty bad. I'm quoting her now. It's pretty bad, and you would have to do pretty bad on a lot of things. I wouldn't go to a 1-star hospital. I think about a 2-star hospital. So, I think there's lots of people out there that will try to argue that these star ratings aren't viable types of things, and they'll come up with conclusions like, well, we're treating sicker people. I also looked at some data from the CDC, and I was curious as to how other hospital systems in the Appalachian chain where we're from, who also share our socioeconomic and some of our health concerns, public health issues, and in particular hospitals in Ashland, Kentucky, and in Morgantown, West Virginia. Their public health scores, according to the CDC and an indicator, we're significantly healthier in our area. But those areas, King's Daughter Hospital in Ashland, Kentucky, has a 4-star rating. Mon Health Medical Center in Morgantown, West Virginia, has a 3-star, and the University of West Virginia has a 2-star rating. And I really firmly believe that part of it is that they have competition. You may also hear lots of discussion about, if you can't really compete on price on government payers, which is true. But if you're all being paid the same, then the only thing that you can compete on is quality. And when you remove that competition, then you remove some of those incentives for that quality. And I get a lot of things from a lot of different people across the country. They know I'm interested in this. And Becker's hospital review on 428 had an article that a friend of mine sent me, and it's quoting your all's Indiana AG. And it was the first time I had heard from him, but he says it pretty clearly and without any doubt. He's right on target. He says, and I quote, merger would lead to the monopolization of Terre Haute hospital system that would be unchecked in raising healthcare costs, stifling innovation, suppressing wages, and reducing access to care. So your AG, who's going to be somewhat responsible for the overview of this COPA, is saying that it's not a good idea. And unlike Tennessee, where our AG is picked by the Supreme Court, you all have the opportunity to vote for your AG, and he is not term limited. So I would make sure that if you're concerned about this, that within the next day or two, that you fire off a letter or an email to your AG thanking him for his opposition to this COPA, because he's probably taking a significant political hit from people who are in favor of this, especially the hospital systems. And he needs all the support that he can get right now. Just one other thing, again, I don't want to harp on policy and politics, but the Biden administration was opposed to these types of mergers. The Trump administration during the first Trump term, he was opposed to these type of mergers. The current commissioner of the FTC was the former Solicitor General of the state of Virginia. So he has firsthand understanding and knowledge of COPAs. And even under his leadership, the FTC has doubled down on their opposition to this COPA.
And Danny, I'd like to add to that because you wonder why. Okay, so did the COPA cause this? I want to give an example of how that care is effective. With the COPA, it's become much more difficult to recruit and retain talented and skilled oncologists as well as other healthcare providers, nurses, advanced practitioners, because oncologists have heard about Ballot and they don't want to come here. Since the merger, we lost 3/4 of our outpatient experienced skilled oncology nurses. They resigned within a year. Over about that many, 11 inpatient oncology RNs left that hospital within the first year. We were left in the outpatient center with only 2 full-time chemotherapy nurses who had more than 2 years experience. That's how healthcare suffers. I can give you a couple of examples too from patients. I had a patient who needed high dose chemotherapy periodically and it had to be administered as an inpatient. And when I was trying to admit him for his second admission for this, there was only one RN available who could give chemotherapy at the hospital at that time. And the following week, we needed 2 emergent admissions to Holston Valley. And when we were talking to admissions to try to get this, lots of time spent talking to admissions, trying to get patients admitted, But we were told there were beds available, but they were blocked off because we did not have enough staff to accept patients. I have never in the years before of employment had that issue of getting patients in. We were told that they would have to go to Indian Path or Johnson City Medical Center. Um, Never were told about Bristol Regional. And one of these patients who incidentally was dying had to wait 7 hours in our office for a bed. That's how patient care is affected. That's how we get these ratings.
So
Oh, sorry.
No,
go
go
ahead.
ahead.
That's actually kind of related to some of the things that I wanted to mention because I think in my gut, I just knew competition was best. And I knew that we had been promised things in pediatrics that we were not getting. And my patients from Virginia and Kingsport were going to have to travel further. And these were already people, a significant number living in poverty, having trouble, paying for gas and needing Blue Care transportation, which is our local Blue Cross Blue Shield Medicaid program. And so it was really hard for me to stomach some of that. But the things that on the back end that I saw it was a fleeing of talent, of experienced medical talent because of things that I don't know that we always anticipated. So, for example, in medicine and in lots of professional careers, there is in contracts a non-compete clause. And these non-compete clauses basically might say that you have to move from a certain location for a certain period of time, not a small period of time, potentially a year, maybe 2 years, in order to get another position. So, that happens. And what happens to physicians is or some nurse practitioners now and advanced practice providers, they become chained to the area because of family or children, or they have to totally leave the Ballad healthcare area, which is quite large, and disrupt patient relationships. It's not just, oh, I'm so sorry. I have this light that's on a timer and I apologize. It really disrupted patient relationships that had been long standing because people did not feel like they had a choice. This continues today because I have had people say to me, like, I would like to move this position or I would like to do something different. But the only thing they can do is leave the area because their contract may say you cannot compete within a Ballad service area. That's pretty significant. We're like in Virginia and we're in a significant part of Tennessee. So then when a physician is looking, do I want to come in this area, and they see a non-compete clause like that from a monopoly that has such a wide range of coverage, they know coming in, I would probably have, depending on what kind of practice they're in, I would probably have to leave this area to continue my life if things don't work out. And so that is really significant. The other thing that's significant that I don't think I totally realized, and we actually didn't know it was going to happen, Ballad Health, when the merger happened, became the largest employer in the Tri-Cities and Southwest Virginia area. Right now, it kind of like competes with Eastman Chemical as to whether or not it's the largest employer. They're neck and neck. But they have a contract with Blue Cross Blue Shield for their employees, for their health insurance, that if they go to a Ballad Health doctor or a Ballad Health facility, they do not have to pay for their care, which is great for the employee. I think that's wonderful for the employee, but it seriously affects competition for those of us who provide care to our patients who love us, but may work for Ballad Health, who are looking at, I love the relationship I have with you, but healthcare is expensive. And they are offering that I don't have to pay a copay. or that, I have a high deductible, a $7,000, $500 deductible. And if I go to Ballad Health, a lot of that care is covered. And so that is even a way that they affect competition in your area that you don't even realize is occurring. And that happened after. It's legal, but I just want y'all to understand that it really affects competition. The other thing that has been kind of an issue, and different states have different ways of handling this. I watched nurses that I may have taken care of their family have to work through forced overtime during the pandemic, which was very hard on them and very difficult. And it was not easy for them to decide, like, I'm just going to go somewhere else and get a job. It's not that easy in our area to find those types of jobs as a registered nurse that pay well and that are still keeping up their hospital skills. So they do have circumstances that just get locked into. The last thing I'm just going to kind of touch on temporarily is that I do have to say in pediatrics, my thought when we had our NICU taken away from us and we were being asked to do something that I felt was not appropriate was in pediatrics, most of our care is, we see people mostly as outpatients. And so I thought, let's just pull out of the hospital. We'll pull out of the hospital and we just won't go there anymore. And that has started to happen as a trend. The rest of my group did not agree. They stayed in the hospital. Well, it's several years later, and guess what? Pediatricians finally had to say, we're pulling out of the hospital because there are things that we needed that you have not provided for us. Now, Ballad has done what I think they needed to do several years ago, which is provide a certain hospital service line to provide for children in our local hospitals and areas. But doctors had to pull out and affect their own ability to have income in order to get the hospital to agree to certain care. It's happened in GI, it's happened in other areas. And so I just want people to understand, you may not know this is all happening in the background, but it's their only leverage for some physicians. Surgeons can't always do this. They need the hospital, and the hospital knows that.
And
Yeah.
as a provider in the system, you cannot speak out. If
Yeah,
you're
right.
in the system, you cannot speak out. In the COPA that we have, Ballad was to invest $70 million over 10 years in to improve workforce compensations. And instead, we saw our oncology nursing certification pay decrease by 50%. We saw the top out pay for nurses was reduced. If you don't know what top out pay, imagine being in your job and told you can never make over this amount of money, ever. Ever. So you could work 20 years and never have a pay raise. And we are already at nursing salaries that are 32% below the national average. I'm sorry I jumped in there, Dani. I just so passionate about this.
Yeah, no, and I want to do that. But first I want to get to Alex because Alex was coming in at the same time as Dr. Johnson. And then I want to clarify a couple of things and add to what Johnson said. And then I'm going to go to Dan. Alex. But you're on mute.
Sorry about that. Am I good?
Yep.
Can you hear me? Okay. So I have a story. So right when, they were going to close the NICU, I know for a fact that they offered a 50% slash to one of the neonatologists. So PJ Powers and my dad were friends. They went to medical school together, and then they just happened to move to the same area. They offered him 50%. They basically, which is ridiculous. I mean, he had, 25 years experience, they basically forced the people out so that then they could say the NICU had to close. And I think that's just something that that's one of their tactics. And then the other thing that they'll do is like with the nurses, they're basically making it such a hostile work environment that they have to leave. And then it's like, oh, we had to close that ICU. So there's this really great document by the FTC called Key COPA Facts, and they have all these claims with the facts. And one of the things that I think is super important is that there is no wasteful duplication in healthcare. There are acute conditions that require treatments within an hour. Trauma is one of them. The golden hour of trauma is real. If you do not get treated in that amount of time, you can die. Your mortality rate goes up. thousands of studies on this. There's no duplication. So like with them saying that this is wasteful, we're not widgets. Like, you know, like there's no waste here. You know, like a hospital is well-trained people inside of it. It's not brick and mortar.
So I do want to hop in, and then you mentioned Dr. Powers, which took me to a whole different place. Dr. Powers, PJ Powers, was Bella's neonatologist. And so I'll share, this is what I mean about we had incredible people. So Bella being born at 26 weeks, she was in the incubator, the ventilator, for a really long time. And when your eyes are exposed to oxygen that early, they start to get this little film over them. And so at one time they were scared with Bella that if we weren't able to get out of there, that she was going to be blind, right? And so they ended up, you know, we moved her out and the film went away and all of that. But there's this thing called retinopathy. And so I took Bella to the ophthalmologist just a year ago. And it's a pediatrician one. She's worked with preemies before. And I've got this beautiful picture of her with Bella's eyeballs, and they're put up on the screen. And she says, look, Bella, she said, see these little lines right here? She said, yours get a little squiggly toward the end, but look, that they go all the way out. She said, you're a walking miracle. Every physician that looks at her and says, you have no retinopathy, you have, like, she has some lung issues and chronic stuff, but I have a walking, talking miracle. And when we went to her first NICU reunion, Dr. Powers was holding her. And he had this ugly cat at the bottom of his tie. And I will never forget, she reached out for the cat and he goes, oh, she can see the cat. He was so thrilled. He remembered, right? These things matter. All of it matters about the type of care that you get. And for those of you all who say, well, if your attorney general worked with your Department of Health, did they not put protections in? Let me tell you something, folks. Once they create a hospital or a healthcare system that has the majority of the patient care, they've almost created something that's too big to fail. So in the beginning, Ballot Health's terms of certification said they could not have non-competes. That's what it said in the beginning. And then that got changed, right? And it said, you know, every year we would see the July of every year, we would see our terms of certification change, and protection after protection after protection would be rolled back because they'd ask for something else, or they would just do something else and then ask for, you know, to be covered later. So it wasn't a thing. And I want you all to understand something. When we started this, we had 2 level 1 trauma centers. A level 1 in a trauma center is like the best of the best. A level 3 in a NICU is the best of the best, unless it's a children's hospital, right? So in the beginning, people were like, I don't understand why is one a level 1. They just want to confuse us, I guess. But we only have 1 level 1 trauma center now. We only have 1 NICU now. When they made the choice about where to leave our level 1 trauma center, they chose the non-centralized facility. And it cut 84,717 people outside of that golden hour of care. They could have left it at Holston Valley and 17,000 would have been out. Right, 17,000 is not minimal, but it's better than 84,000, right? When they start to do things that are driven by money, like choosing what types of infusions you can get inpatient versus outpatient. My friend Teresa, her infusions went from $3,500 a month to $13,995. You see Wendy's head shaking because she knows what was at the infusion center, and them choosing which medications can be available. There are so many things that the average person, I did not know all of these things. I wish I didn't have to know all of these things. This is not my field. But I wanted to be able to explain it to the people in my community, the people that were impacted. And I'll tell you this, the employees, they would all come to me. When they talk about the retaliation and the environment, if you Google me and Ballot Health, you will see them claiming, them banning me from the hospital and claiming that I was being disruptive and like all kinds of things, right? They tried to make me a felon for dead grass, so many things. But the thing is that they were scaring employees. They would literally take screenshots of my social media to track employees that were just watching my lives. Now you might say, why is this a big deal? It's not about me. It's about the employees that work in that environment. And employees that work in that environment, it has to impact care over a period of time. And that's before we even talk about the minimization of the supplies that are available for them to do their care. You see, somebody from Ballot is literally on my TikTok saying, threatening us. Yeah. So people were told not to talk to me, and that's okay. But I would like for you all to speak to some of you, the healthcare professionals, to talk about the change in our patient to staff ratios. I know that I experienced that with my mom, but yeah.
I'm
If you
gonna
don't,
have oh, I'm sorry. I'm gonna have to get off soon. And I just want to say something because I don't believe in, like, I think competition is good. There has been good in pediatrics. Um, so because, and Dani knows a lot more about this than I do, but because of the way you get defined as like a safety net hospital or a trauma center, closing the NICU in our area and qualifying for certain funds did allow our children's hospital to grow and get staff that we prior to that time struggled to pay for and to have. And so I have seen this positive, which I think is really good. We have like a large number of hospitalists now. We have an additional, we have additional pediatric surgeons. We have additional pediatric GI doctors. So I do feel like, in being fair, there has been positive growth in that regard. It was like sort of painful getting there. But I know a lot of people aren't maybe using pediatrics, but I do want to express that.
But
Yeah.
did Ballad directly help do that, or was that just a side effect of the fact that Ballad's there?
Well, there was a TennCare change. So let me be clear. There was a TennCare change that happened the year before the COPA was actually granted, and a lot of people don't know that. It was, see, Dan is smiling, but there was a change in how much money you could get when you qualify for a safety net hospital and different things like that. And you had to be the only children's hospital or NICU in a certain region in order to get these extra funds. And I know that we've been able to get more of those people. And here's what I will say is when I know that the only NICU that we have is certified for 38 babies, and I know for a fact they've had as many as 57 in that NICU, I struggle. I'm glad that they've been able to hire more people. I struggle with knowing that there are babies that are in the NICU that should be 1-to-1, 1-to-2 at the greatest, that are 3 and 4-to-1. I struggle. So like I hear that they finally gotten to that place. I also just don't know that I can, and maybe it's because the NICU is so personal for me, right? But I just have a hard time with what it took to get here, and even for just the smallest of those small wins. And here's the other reason why I say that. The region that we live in, we have, how many nursing programs do we have in our region back home? Somebody? 5, 6, 7? Quite a few. Why are we struggling to have nurses? Because of the company, and people know the reputation. It's why they've had trouble getting travel nurses. These things do impact they do impact your ability to recruit people and get people. And I feel like this, and this comes from my advocate heart. Dr. Johnson's a doctor, and she's much more level-headed than me. She's just more practical. But she has a great heart too. Let me say this. When I was looking for where I was going to take my grandbaby and all my grands, It was either going to be her or Dr. Sarah Yusoff. Those were my two. So she's got an incredible, you just have no idea. She has a great heart too. I just come from this advocate's perspective that says, I know for certain the people that have died because of the reductions that we have seen in our region in our healthcare. I don't say that lightly. I know what it is that I'm saying, but I know it to be factually accurate, which is why I say it. It is why on a Sunday, in the middle of the afternoon, we're on a Zoom call talking to you all, because you have an opportunity to stop these things from happening in your region and to implore your state and your Department of Health to find other ways to give your hospitals the resources that they need. Here's what I would say. Maybe if we didn't have 10 or 15 people with the title of VP and, being paid $250,000 a year, and if our CEO didn't go from making $1 million a year to $4 million a year, maybe we could have paid for the hospitalists and nurses with that money instead of closing a NICU. But that's where my advocate heart comes from. I'm glad that there are good things happening in the area of pediatrics. My heart just grieves for what it has taken for us to even get that small win. So, Dan, I know you wanted to hop in here, and then Wendy.
Well, I was just going to mention, that there's all kinds of appeared data talking about, we don't need to talk specifics about ballot healthcare, but
Yep.
because there are lots of articles, lots of information out there. The FTC has done a lot of research on what happens to competitive labor markets when you have a monopoly. Doesn't matter if it's healthcare or anything. You stifle the labor market, and so a lot of this stuff that we have specific information on, even back in, I just pulled it up, it was June 18th of 2019. If anyone wants to go back and watch the videos of the health check on COPAs, they were even talking about that even back then, that we were going to see a reduction in staffing and employment, and there was going to be a real economic impact to this. And even back, I went ahead, wanted to do some research. I wanted to go back as far as possible and see how many articles I could find. And I found multiple things going all the way back to 2016 during the Obama years. The White House did some extensive research on labor markets with monopolies also. And so this is well known. It's going to happen, and there's not a whole lot that you can do to really change it.
To piggyback on what Dan said, I will tell you this: the furthest back that I've gone to find a policy paper from the FTC on COPAs, the earliest one that I found was all the way back to 2006. So this is something that they have been studying for a very long time. They've had a COPA in Montana. I was at the same workshop that Dan is talking about for the FTC, COPA healthcare checkup, right? But every single one of them, ballot is the first COPA I've ever known. It's in my hometown. It's in my community. It directly impacted people that care for my family and all of that. And so I feel very right when it comes to that. But he is absolutely accurate. All of the data, all of the experts that look at COPAs tell you that this is a horrible idea for patients, for employees, for communities, all the way, and especially for independent practitioners and all of those individuals. So he is right. It's not just that ballot was a horrible COPA. They were a horrible COPA, and COPAs are horrible. So I just want to put that out there. So
and just one other thing real fast, in throwing out numbers and maybe giving you some additional data on some of the stuff that you're hearing from local people who aren't opposed to the COPA. The Tobin Center for Economic Policy, which is in Yale. And I don't know if anybody has seen this. I don't know if any of you've seen this, but it's Zach Cooper. He Cooper has been looking at these types of things for 26 years in healthcare, and he basically in his argument opposing, he takes some of the public comments made about why this would be a positive thing and tries to debunk them. He said that the merger would create a de facto monopoly, that they're going to have 75 to 100% of the market share, despite assurances from Union Health and Terre Haute Regional Hospital. Consumers would not be protected from price increases, and he actually makes predictions of maybe as much as 40% once the 7 years is over. But he says even prior to that, the prices will go up in insurance premiums. Local community is overwhelmingly opposed to it. He says that there's information out there that 80% of the people in your community are opposed. COPA laws, like the one in Indiana, do not protect consumers as intended. He goes on to explain that. And then the other thing that, and Dani's also said to this, is that Terre Haute Regional Hospital is performing, their margins are performing better than 75% of the hospitals in the country. If HCA decides to close that hospital, I think another hospital system will come in and reopen it. Because if they're doing that well, and in the absence of the merger, I think they're going to continue to do that well.
100%. Let me do Alex and then Wendy.
One thing that I think people need to realize is that there's all this talk about the oversight, but there really is no real oversight. I mean, there are no metrics. Like you spoke about how they changed every year, the benchmarks got a little further away. There are states that are coming out with new laws against holding administration accountable. We have licenses that kind of hold physicians, nurses, all the practitioners accountable, and administrators don't have those. And so they're starting to get those. And I think that would be a good first step. But if you're a COPA, why do you need, if you're two hospitals that just want to have a merger and it is honestly financially viable, why do you need to be protected by antitrust laws? I think that just tells me that this is not really a good plan for the community, and they're just trying to get it under the radar.
Yeah. So to what Alex is talking about is when we talk about oversight from your Department of Health, here's what I can tell you is that our Department of Health, even with 3 or 4 people in that department, could not keep up with all of the things that Ballot Health was doing. There is no, and it's not defined. Let me just say this, you all, active supervision is not something that is a legal term that has been tested, that we don't even know what that looks like. Is it just annual reports? Are you just reporting what they give you? Is that you actively supervising? What we ran into a lot was our Department of Health saying we can't tell an independent company, a private company, what to do. And my thing is, well, you should be able to, because you gave them a license to be a monopoly. So we didn't. So those are some of the challenges that we ran into when it came to trying to enforce, because what ours said, any disadvantages that the benefit to the public had to outweigh any disadvantages that might result from the reduction in competition. And I could give you a laundry list of disadvantages that happened to our community as a result of this COPA. And not once has our Department of Health even so much as fined Ballot. And I just want to give you a couple bullet points, and then I'm going to go to Wendy before we open it up for some Q&A. So Brett Kalman and Samantha Liss at KFF Health News have done some really terrific reporting on Ballot Health in the last year and a half. And one of theirs that came out in September of 2023, it gave you and this is from the Department of Health, the Tennessee Department of Health's website. This is from their documents. Ballot Health has not fulfilled the annual charity care obligation it made to Tennessee, falling short by $148 million over a 4-year span. That number's increased now. In those same years, Ballot took thousands of patients to court to collect unpaid bills. Here's what I can tell you for a fact. In its first year as a medical monopoly with a COPA, Ballot Health sued 6,700 people in our region for healthcare, in a region that has a pretty significant population that is in the poverty level. 8 to 10% of the population doesn't have reliable transportation, all the things. They sued 6,700 people in its first year, meanwhile, not giving enough of their charity care. Charity care is where people that meet a certain requirement, they are like less than 200% of the federal poverty level. And then they're supposed to be able to kind of get their apply for financial assistance and not be charged for care, or I have a sliding scale. Okay. In addition to that, they failed to meet, Ballot failed to meet 80% of their quality care benchmarks that were designed by the state, right? To make sure that the quality of care did not decline. Well, it did. They failed 80% of them, including rates for infection and death, which is what I was telling you about earlier, right? So just so you all understand, this is what happened in our region. And when we talk about oversight, like Alex said, it didn't exist for us. It still doesn't. They have not been fined for not meeting any of these obligations. Our COPA wasn't modified, which was another mechanism that they were supposed to be able to use for enforcement. It did not happen. Wendy.
Thanks. I wanted to make really clear that under a COPA, your healthcare decisions may be made by a boardroom, not your clinician. I saw through the P&T committee, we were actually told cancer care is not a right. Cancer care is not a right. Really? Wow, you remember that. Yeah. And that philosophy has influenced so many clinical decisions because patients are now limited in certain drugs that they can obtain, maybe lesser effective drugs and cheaper drugs. A COPA should not be about cancer care is not a right. It's not what cancer care should look like. When you have unaccountable financial gatekeepers, this has been enabled worse by COPA, by this COPA that we have.
Yeah, awesome. I'm going to open it up for Dr. Johnson, Dan, Alex Mackey. If you guys have anything you want to make sure that you tell folks before we open it up for questions, what you got for the people? Anything else?
Yeah, I'll just say one other thing. I pulled this up earlier today. I had to find it, but back in and this goes to the employment thing and what's been talked about, but this was back in October 20th of 2023. Becker's Hospital Review did a survey of 200 hospitals, and it was on nursing satisfaction scores, and 146 hospitals replied. They had to meet a certain criteria for size. And of the 146 hospitals, Ballot was included, and they ranked 146 out of 146.
Yeah. Yeah. It was, that one came out, and there was another one that was right after that one. But here's the other thing. Our hospital is our healthcare system is nonprofit, and a lot of people think, oh, that means that they're great. Let me just be clear: nonprofit and for-profit in hospitals is not a deciding factor as to whether or not they are good for people or any of those types of things. I will say this: if you have a nonprofit hospital, you can look up their Form 990s, which are their tax returns, online. I encourage people to do that because a lot of people have no idea everything that goes on behind the scenes with these decisions. What I can tell you is this will not be good for people, for your communities. I don't have to live in your community, in your county to want you to understand the severity of what is on your plate. The great news out of all of this is that you all have between now and November 9th to, in every way possible, make your voices known to your attorney general, to your Department of Health, to your state legislature, to your local politicians, your mayors, your city councils, your county commissioners, all of those people. You have a good window of time. And here's what you have that we did not. I didn't get contacted until the COPA had been granted. And we were already about to lose things. So we were fighting from behind. You all have the opportunity to fight in advance with information, with with facts, with statistics, with experts, right? Those are the things that you have available to you. And I just really do implore you all to use them. There have been, listen, people will say, do you ever find anything good about ballot? I can tell you one thing that we agreed on. Okay. We agreed that during the pandemic, people should wear masks, right? That's what we agreed on. We agreed on masks and PPE, and we're a very conservative place. So a lot of people were, it was a hoax and don't wear masks and all the things. And I reached out to them, to Jamie Swift, as a matter of fact. And I said, hey, Jamie, because a lot of people back home follow me on social media. And I said, Jamie, if you want to join me on Zoom, I promise I won't ask a single question about the NICU, about staffing. I won't ask anything, but we can join together as a collective voice and tell people to wear masks. And I never got a reply. So, I don't know what that says, but what I will tell you is that all that I care about and the people that are on this panel with me care about is what's in the best interest of people, and what's good for your health and well-being. And that is definitely not a certificate of advantage. I'll let each of you kind of round out and say your last little tidbit, and then I will open it up for any questions from the folks that are on Zoom, as well as the folks that are live as well. So, Dr. Johnson, you want to end with anything?
No, I think I said all the things. If anybody would have any questions, I'm more than happy to. I feel like I give sort of a balanced view because I feel like I've had some positive come out of it, but I've also realized the negative effect. And so I'm more than happy to answer questions. I do have a patient that was contacting me, so at any moment I might have to
no worries,
be gone. Okay.
I appreciate you very much.
Yeah, no problem.
And you know that. Yeah. So, okay. So Wendy.
I still live in this area. My mother was recently diagnosed with a very aggressive cancer, and we deliberately chose a provider outside of the ballot system. Although I have worked with the most wonderful oncologists and nurses ever in oncology, but I knew the negative physical and financial impacts that using the ballot system would have on my mother's care. So I would just say to other states like yours, considering a COPA, learn from our experience. This model is not about protecting patients, it's about protecting monopolies.
Yeah, 100%. Sorry to hear about your mom, hon.
Thank you.
Lots of love. Dan.
I think it's all been covered. I do want to say though that these things are incredibly difficult to monitor and supervise. I think our current Department of Health and AG's office is really trying hard. I have met with them on several occasions, and we hear that terms of certification 5.0 is going to be coming out shortly, hopefully within the next month or so. Hopefully it will have additional information in it about quality scores and better quality scores and more accountability on quality scores. So I'm hopeful that that's going to occur. But I think there's also a lot of people in our community that didn't agree with me 5.5, 6 years ago, who have recently come back to me and watched some of those public hearings, and have a little bit different viewpoint on things. And we actually have had some local legislators to try to do some things in the General Assembly. But hopefully you all can avoid all of that by rallying behind your AG and getting other politicians to come in line and see what some of the negative impacts might be on this.
100%. Yeah, 100%. Alex.
I think the most important thing of all this is competition is good in business. Competition is essential in healthcare. It is the only way that there is a check on the system. And I think the biggest part that I learned about COPA and ballot and all of it is that there's no check on that system anymore. We need a check.
Yeah. Yeah. And that's the one thing that I will tell you is each of us has seen these things in different ways. I will tell you this, the last time that my mother was in the hospital, to your point about people pulling out of the hospital. So in 2023, my mom we didn't know what it was at the time, but she had a significant GI bleed, and she was in the hospital quite a bit, and she got to see her gastroenterology practice. They're the ones who did the surgery and all the things, right? Go back now to last year. She's back in the hospital. And they tell us gastro is going to round on us, and it's not my mom's people. And I'm like, well, wait a minute. Where's Dr. Sullivan? So here's the thing. I could look out of my mother's hospital window and see the gastroenterology practice because it's beside the hospital. And they no longer had privileges at the hospital because Ballot Health, because they are so large, it is their way or the highway. Whether you're an independent practice and physician, whether it's an insurance company, whether it's anything, they don't have to come to the table, and oftentimes they won't. And so it is an impact. So now my mother would have to see someone who's completely new, who knows nothing about her. So these are just some of the things that may transpire for you, that tend to transpire for every community that has ever had a certificate of public advantage. My promise to you is that I will ensure that the organizers of this event have access to a drive where I will make sure that you all have links to the FTC reports, to your COPA application, which the public version, like I said, is 247 pages long. It is redacted, but also it's not, but you can still get the gist. And one of the things that our Department of Health, the FTC hired an independent person to review the application. His name is Kenneth Kaiser. I can show you what he says about COPAs. And then the Commonwealth of Virginia hired Robert Town. And both of them came to the same conclusion, is that any benefit that they claim will happen or can, as a result of this COPA, can be achieved without it. It is not necessary to merge people in these companies and eliminate your competition. It's not required. And it will be to your detriment. I can tell you where we are. We have an aging population. We have a lower to middle class, population in terms of wealth. Most of the people that participated in our protest were people that had chronic health issues, because they knew how much it was going to impact their care. So, somebody is asking on TikTok about it's Union Hospital and Terre Haute Hospital, and they are in Vigo County. So that's where it is. Okay, so I'm going to go back to the room where you guys are in. And for those of you guys that are on Zoom and TikTok and all the things, you can ask any questions that you have for as long as we have Dr. Johnson. She might have to go for a patient, and Dr. Alex Mackey and Dan and Wendy and myself are happy to answer anything that that you might want to know. I see them moving around down there, so they're coming to, I think. Helen, Landon. I just want to give everybody opportunities to ask questions. She's asking. There we go. And Zoom folks, you can feel free to raise a hand or drop them in the comments as well.
Hi, Dani. I was wondering if there had been any lawsuits from any patients that had received subpar care.
Absolutely. There have been lawsuits. One of the challenges with lawsuits in our region is because they are the #1 employer. And what we found in our region is that the people that were on the board of the hospital are also on the board of the chamber, are also on the board of this and the that. And it's very incestuous. And so we had a couple of attorneys that would take cases. But so, yes, I can tell you that. Yes.
Dani, I would
So-
like you to explain COPA rights, because I think that that's going to be part of what we have to do with research and stuff for our hospitals. So if you, or I'm sorry, FOIA
FOIA yes.
rights.
So yes, so there are federal FOIA guidelines, and then your state has its own individual requirements for how to send a Freedom of Information Act request. So we're going to be doing a workshop on this too not this upcoming week, but the next week. So when you want information, which I wanted a lot of information, so I would formulate, you can get a template specific for your state. But what you want to do is when you send a FOIA request, like if you're going to FOIA the Indiana Department of Health, and you might say that you want to digitally review all documents pertaining to the Union Terre Haute India COPA application. I always said things to include emails, documents, text messages, all the things, because if they're using even their text messages count, their emails, there are many things that I gained access to that I would not have if it were not for using the Freedom of Information Act. I will also include a link to that in the drive that I'm going to make for you guys, so that you will have a template to see how to ask for things. And here's the thing, if you're asking to review it digitally, there should be no cost. There's a way to do it so that it's very narrow, but still comprehensive. Because what I used to do is I would want to digitally review. And then when there were things that I wanted the physical copy of, then I would say, I want physical copies, and then they can charge you for physical copies, depending upon how. And then, so I just would put a little note that if the cost was going to exceed $25, notify me beforehand. But yeah, you want to be able to use your Freedom of Information Act. The other thing that I would double check, because I haven't checked everything that passed in your legislature, but in our legislature, when they granted a COPA, when they passed COPA law, they went back behind it and they passed a second law. And that second law actually hid much of what was supposed to be transparent to the public. So it said that we weren't allowed to see complaints against the hospital. It said that we weren't allowed to see the contracts of vendors. There were things that we were not allowed to get access to. And so what would happen is sometimes I would FOIA something, and the attorney, it was funny, I would send the FOIA to the Tennessee Department of Health. And then I would know that I had poked the right bear when I got a response from the Attorney General's office. Because they have to reply within 7 days telling you that you can't have access to it or whatever. But check your other laws to see if they passed anything like that there as well. And I can help you with that.
One thing I was going to mention about the lawsuits and stuff. So Indiana has this too, but it's tort reform. So the amount of money that a lawyer could potentially get in a lawsuit is limited, and that limits how many people will actually take those cases. So that's one other thing to be aware of.
Absolutely. And also you want to check, yeah, you want to check your laws too. So like Tennessee is very corporation friendly. So in Tennessee, you only have 1 year to file a medical malpractice suit. Most states are 2 years, some are 3. So you just want to know those things, just not even about the COPA, but just in general. Sue is asking in the Zoom chat, do you know of any other areas in Indiana that have the characteristics that are right for a COPA application? According to your Indiana Department of Health's website, it is only Vigo County that that meets the requirements according to your COPA law. Any other questions? Happy to answer them. While you guys are thinking of questions, oh, I see somebody coming up with a question. Great.
Well, COPA sounds like a nightmare to me, and I write a lot of letters to state legislators and congressmen and governors and AGs. But I don't know how to word it. I don't want to just say I'm against COPA, period. And there is so much information, and thank you, that was presented today. Do you have like a form letter worded so that I could reproduce that and send it?
Yep, I am happy to put that in the drive. And what I'll do is one of the best things that I like to include in it is so like this response from the FTC specifically about your COPA, the quotes from your own attorney general that Dan read to you. I can pull some of those together. Give me a couple of days, but I will pull them together for you. I'll give you like an example. And then I will put it in the drive, and I'll make sure that that Helen and the folks there have access to it, and that you guys are able to do that. Yeah, absolutely, we can do that. When was Indiana's COPA law? Well, so the modification to the COPA law just happened last month, but it was done prior to that. And I'm not sure of the first COPA law. I'm only positive about the second one, that they just passed. And I think it was signed into law April 22nd or April 23rd. Other people are asking about COPAs from other places. Let me just tell you this. There are currently 19 states that have COPA laws. They are Florida, Idaho, Indiana, Kansas, Louisiana, Maine, Mississippi, Nebraska, New York, Ohio, Oregon, South Carolina, Tennessee, Texas, Virginia, Washington, West Virginia, Wisconsin, and Wyoming. North Carolina had a COPA law, which they repealed. If you all aren't familiar with what happened in North Carolina Mission Hospital in Asheville had a COPA law. They repealed that law. They were purchased by HCA.
Maybe get black.
And what I can say is that they have had a horrible time. I will say this, their nurses actually unionized, go them. But their hospital got so dangerous that the Centers for Medicare and Medicaid actually issued an immediate jeopardy on the hospital. And what that means is you're in immediate danger, pose an immediate danger to the patients. And if you don't rectify these things, you risk losing your accreditation, which is serious. Anything else?
I also have to head out, but I wanted to thank you.
Yeah, I appreciate you, Alex. A bunch. We'll be in touch.
All right, sounds good. Nice to meet you.
Yeah.
Dani, I would like to thank you and the panel for showing up for us and certainly educating us. Is there a hospital corporation that is in mind for enacting this? And do you know if there are opposition organizers on the ground in Terre Haute Union, in the county that we can reach out to and work with?
So according to the article that Dan read, you guys do have folks that are opposed to it. I'm not sure how organized they are, but I'm certainly happy to assist. That's kind of my wheelhouse. So happy to assist in that effort. What it would be, and I haven't looked at all the financials behind the application because it's 247 pages, right? But these two hospitals are the two hospitals that are looking to merge together to become one entity. When that worked with us, they came up with a new name for that new corporation, right? And it was supposed to be that the board of directors was going to be made up of half of these folks and half of these folks and all of it. Just did not come to fruition that way at all. So those are the two hospitals that have put in the application, and that's who would be involved. Dan, did you want to hop in? I thought I saw you. Nope. Okay. Yeah.
So Ballad was born out of your COPA merger?
Yep. So we had Mountain States Health Alliance, which was one health system. And then we had Wellmont Health System, that was another health system. And they each had their own hospitals. And so when they were allowed to have a COPA, they became one entity, which is now Ballad Health, right? The thing about it is, and this is where it gets, I wish I had a forensic accountant on speed dial that just loved pro bono work, because what's difficult now for us is that all of their assets and they don't function as just one. So now if I want to look up, which I do it every year, their financials on their Form 990s, which is their tax returns for a nonprofit, some of it is reported under Ballad Health, some of it is reported under Wellmont Health System, and some of it is reported under Mountain States Health Alliance, even though technically it's supposed to be all one entity. They have not put all of the assets and all of the money in one place. And so one of the phrases that the FTC kept saying to us and to the Department of Health is, once you scramble this egg, it's very hard to unscramble it. And that became the challenge with us. We had equipment taken from one hospital, taken to another place, and this happened. And it was just, it was not great. But yeah, Ballad was born out of our COPA. So Union and Terre Haute, those two would, I imagine they've already had talks about what they want the name of the new thing to be and all of that. And they'll spend a ton of money on marketing and branding and new signs and TV ads and all the things.
But health in and of itself is not a nationwide or a regional. It's pretty much confined to your hospital region that they were grown from.
Yeah, so our region is geographically the size of New Jersey. It affects 29 counties. So we have the largest healthcare system operating under a COPA in the entire country. Ours is the largest that's ever been done. And it impacts 29 counties. We started out with 21 hospitals. They still claim we have 21, but we don't. One of them is closed. They just answer the phones. There's nothing there. It's in Southwest Virginia. So, but yeah, that's how big ours is, 29 counties. Yours would be one county, but the only two hospitals in that county. So your ability to get second opinions, your ability to, get independent, to get somebody else to go against whatever, like it's literally all going to be under one umbrella if they are granted that COPA.
Thank you.
You're welcome.
Dani, I wanted to just, I have been in some talks with the president of the league in Terre Haute.
Yes.
And she called me, I think it was last night, and said that Terre Haute is having a huge town hall there tomorrow on this subject. So they are aware and they are working on it. So
love that.
Wanted to add that.
Love that. Perfect. Yeah. And that's what you want to have. That's what you want to happen. And what I will say is that one of the things that I purposely did when I went back home and we were fighting this COPA was I just made it about this one issue. We could disagree on a bajillion different things, but on this issue, I will talk to anybody that wants to get this done. I will stand, arm in arm with anybody that wants to, fight for the healthcare of the region. And so, as you've heard from people on the panel today, we don't all agree in our political views, as Dan smiles at me. And that's okay, right? So what I would say is do your best to make it a nonpartisan issue. Do your best to bring in people from every side of any aisle that may exist, because it collectively impacts everyone. And it's a great issue to rally around.
Okay, so if this healthcare system is formed, Dani, in Terre Haute, does it have to be that particular healthcare system that would do another region or add to the additional region? Could there be another one, another COPA, or is it only one? I guess that's where I'm confused.
Yeah, so here's the thing. This is a specific COPA. The way that your COPA law is written, there are requirements that that the county has to meet in order to qualify for a COPA. The only county that currently qualifies that meets those characteristics is Vigo County. And what this last law did, what this last SB 119 did, I went back and read it again this morning to make sure I got it right. It changed the time frame. It originally said that that healthcare systems or hospitals had until July of 2026 to file an application to get a COPA. That was changed. Now, if anybody in Vigo County, which you only have 2 hospitals, wanted to file a COPA application, they would have to do it by May 13th. And the Department of Health has to issue their decision by November 9th. So this is the only one that you have on your plate. And if I'm reading and understanding the law correctly, if you all defeat this and the Department of Health does not grant them a COPA, your 2 hospitals are going to continue to exist separately, just as they are right now. And the way your current COPA law reads, nobody else can submit an application for a COPA in the state of Indiana. So this would be a huge win, not only for Vigo County, but for the entire state of Indiana.
Okay, that tells us what we need to do.
Yes. And I was so great. When I saw today that you had until November 9th, I literally did a small little dance. Because you do have time. This is where you literally want to talk to your neighbors. You want to, so one of the things that I did was I did a little infographic that had myths on one side or claims on one side, and then facts on the other. And the stuff from the department, the stuff from the FTC is a great way to do that, because they address every claim that these hospitals are saying they can achieve, and it tells you what their response to that is. And so these are things that you can print out. And when you all have county fairs, when you have festivals, when you have farmers markets, if you want to knock on your neighbor's door, because this is great. It's not about a political party. This is about your hospitals, right? So you all can get out into Vigo County and let people know what this is. And give them that information. And then you write letters to the editor, and you contact your legislators, and you get behind your attorney general, and you make sure everybody knows what your attorney general said about this thing and how horrible it would be. And you've got time to prevent it. Yeah, you do. We didn't, but you do. And I will help as best I can. I know we're down to the last 10 minutes. You guys, if you have anything else, I'm happy to answer. If not, that's okay.
Why don't you tell them about your site and how they can go on to your link tree and be able to get this information? I will be able to do it, but anybody wants to go do that on their own, you might explain your Facebook page or other, where they can follow you and get that information.
Yeah, sure. So I am on social media as @the Dani Cook, right? So THE and then just my name. And on Facebook, YouTube, and on TikTok, in my profile, I have a link tree with lots of resources for different things. I will create a new collection specifically for your COPA, and I will provide links to like all of the documents that we're talking about today. Any document that I create for you that I put into a Google Drive or any of that, that link will also be in that collection. So literally, once you go into, thank you, I appreciate it. Somebody from back home who also works for the healthcare system is on TikTok saying, I sure hope they can stop them. Good work, Dani. Everybody back home is really hoping that you all can prevent this from happening. You know, I can't express to you how strongly you don't want this. You really don't. When I was outside of Holston Valley Medical Center for 257 days, I cannot tell you the number of people that came up to me and shared with me the things that happened to them. I can tell you about Jeremiah Fields, who was the first major trauma to come into Holston Valley after they downgraded our trauma center. Jeremiah was 36 years old, and he was in a car accident and was ejected through the windshield. Jeremiah came into Holston Valley with what's known as a chest flail. It's a very serious, often fatal injury. Jeremiah came in on a Saturday night. I was outside the hospital when he came in. Jeremiah passed Monday morning. He never got a chest tube put in. He never got a follow-up x-ray. I think his lowest blood pressure reached 52/12, something like that. It was a major failure of his care. I filed the complaint with the Department of Health. Ballard was found to have broken both laws and healthcare regulations, and the Department of Health did nothing to them. They did not, they never got fined. They never got anything at all. 2 days after he passed, his fiance and her mother showed up outside of Holston Valley and knocked on my little tarp and asked, could they come in and talk to me? And I listened to audio of him in the hospital crying, saying, God help me, I'm going to die. And he did. And he did. So, yeah, I'll help in any way I can. But so YouTube, Facebook, Linktree, YouTube, Facebook, TikTok, in my profile, there's a Linktree there. You will see a little collection. It will say Indiana COPA documents. Somebody just put it in the chat on Zoom. So thank you, Camille. I will put all of your docs in there for you so that you have them. And I am happy to help in any way I can. Yeah. So if you, and also I'll just tell you, if you Google Ballot Health and KFF, you'll see a ton of articles that Brett Kelman and Samantha List did. It's just really great work, and you'll see, and I'll put the FTC resources together for you.
Dani, we want to thank you so much. You know, Dani was going to come initially, and I couldn't get a bigger venue because we tried to do it too fast. And by the way, anybody here, never try to book a venue in May. There is no such thing available. But I think this actually worked out better because we are able to record, and we are going to be able to pass this information on to our sister group in the Terre Haute area and the Virgo County area. And we're going to start there, and we're going to take it across the state. So we thank you so much for all of your information, all of you. And we're going to fight, and we're going to try to keep this thing out. Thank you so much.
Yeah, I appreciate you all for doing this, for showing up, for taking an interest and advocating for yourselves. I'm very grateful. I'm grateful to Wendy and to Dan, and to Dr. Mackey and Dr. Johnson, who have already left. Guys, we don't have to agree on everything, but when we do agree and it's this important and lives are on the line, we need to be about the business of making some good trouble together. So I will help in any way I can. So I appreciate you all very much. Thank you. See you later. You're welcome.